Hello, everybody. Welcome back to our BE School, Be Better, Be Empowered podcast. I'm Dr. Emery Pitcel of Rothrock, Chiropractic, and Rehabilitation. Today, I was fortunate enough to get Rebecca Hall to join me. She is of Happy Valley Bodyworks. If you guys haven't seen our podcast on the pec muscles for the month of May here, please go back and watch it. But otherwise, what we want to show is we want to show some of the techniques that we were discussing during the podcast.
Yeah.
Like we kind of alluded to, pec muscles is actually a rather common problem. This is a group of muscles that's going to frequently be adaptively shortened, over recruited, and tight. That's posture related. That's to the fact that a lot of our world is push and less of it is pull. And then just all these sorts of like athletic or performance things that we do that just are overhead and front and whatnot there.
Mm-hmm.
So what I want to show is two techniques here today. One is going to be a face down technique that Rebecca is going to help me demonstrate here. That's going to allow us to get after where part of the pec muscle inserts in. And then the other one is I want to show how we can actually do like a really active stretch release technique, and that will be done on your back.
Perfect.
You ready to get started?
Let's do it.
All right. I'll start you face down on the table here then, please. All right. So Rebecca is going to start face down on the table here. If we frequently we're talking about the pec muscle here, but frequently with the shoulder, we're going to find that there's going to be a directional preference if the pec muscle is creating a derangement problem in the shoulder. Then the best way to think about it is what is the right way? What is the way that we want to overwhelmingly move the shoulder and all those muscles and the joint complex into that is going to be the most favorable for decreasing muscle tension, improving flexibility, and cutting your pain down. One of the most common movements is actually hand behind the back, internal rotation. So instead of just telling the patient, okay, go home and work on a boatload of those, which we'll still tell them to do that, but you come to the office, I like to try to help you out with that, with your flexibility at the joint itself and getting after the muscles. So what we're going to do is we're going to take Rebecca's hand and we're going to put it right in the small of her back behind her back here. And that's already starting to put a little bit of stretch load on the pec minor and just a little bit of productive stretch on the pec major muscle. What I'm going to do though is I'm going to be taking her shoulder kind of as far over as we can. What do you think? Is that okay, Rebecca?
Oh yeah, good stretch.
Good stretch on that, right? You could definitely feel it starting to load. Mm-hmm. And then what I'm going to do is I'm going to use kind of like a pin and stretch contact, and I'm going to get after the main bony prominence that we're going to go after is right here in the front. You can almost feel it on yourself, and it's probably a little tender, and it's called the coracoid process. We're going to be doing a lot of work on that, and she's going to tell me right away if I'm too mean on it, okay? But while we move that over, we're going to pin and start to really work on that coracoid and repetitively move that shoulder back through here. Rebecca, how's that pressure?
Oh, it's pretty intense, but it's not bad.
Should I lighten up or anything, or is that good?
You're good.
My rules in here are typically like if it's any sort of muscle stripping thing, hey, let's make it hurt up to maybe a 4 out of 10. Maybe we could live with a 5, but as soon as it's like a 6 or a 7, we got to lighten up. That's too aggressive. We're just going to inflame that son of a gun. So we can like do that work around that. That's really kind of getting after like that pec minor. We could kind of move a little bit onto like the side of the shoulder here, closer to like the greater and lesser tubercles, and that'll get a little bit more of that insertion point for the pectoralis major. How'd that feel, Rebecca?
Pretty good.
All right. Just for completeness, I'll show a couple of techniques over on this side, just in case it helps everybody at home get a slightly better vantage point. My hand behind the back, and we're just going through on this side, right?
Mm-hmm.
How's that feel?
Good.
Awesome. And again, maybe an office, dozen or so swiping contacts, and just get that blood flow, get that neurological reset, get that flexibility at the shoulder better, and really kind of go to town on all of that. Take your time when you're ready. Can you flip over so you're face up then?
Yep.
Absolutely. Awesome. So that was the first technique, like a hand behind the back stretch. Get your mic back right there. This next one we're going to do is what we call a post-isometric relaxation. We'll get people stretching the pecs. Again, that's one of those, my favorite way to give it is for people to lean on the forearms through a door frame or in the corner of the wall and try to have the shoulders down and just really kind of pull that through and lean to add overpressure to take all that tension out of there. But like everything, it kind of helps if we're able to help you with that. Mm-hmm. Actually, quite honestly, we talked about assessment too. your right one sits a little bit higher than that.
Oh,
So
yeah, it sure does.
can't help but assess while we're looking at it, and she probably has caught on her own that is part of the problem. But I like doing both at the same time. One, it's efficient, and two, you kind of just always want to work on both sides anyway.
Mm-hmm.
So she is going to go palms up and kind of reach out her hands. For those who have seen like the movie Titanic, it kind of looks like Kate Winslet doing the front of the boat scene, right? And then what I'm going to do is I'm going to do flat hand contacts and help to get her shoulders and her her shoulders and her chest kind of down like this. Tell me when that feels like a pretty good intense stretch. Is that okay?
Yep, we're good.
Now, what she's going to do to add a little bit of an active component to this is she is actually going to try to be bringing her arms back up together like this, but she's only going to be giving me about 20 to 25% of her overall effort. So that way she doesn't end up moving. I say, like, don't let it, like, I'm going to win this. Like, don't try to beat me, but like, you're going to try to go 20, 25%. I'm going to hold you in place, and that's okay. But after about 5 seconds of doing that, we relax. And then I'm going to be able to take her further into the stretch, and you're going to be able to see that on here. So here's kind of the stretch. And then we tell you, like, kind of like actively try to pull those shoulders back up. 3, 2, 1, relax. And then after that, we're actually able to kind of like walk those hands a little further down. Right? How's that feel?
Good. Still an
Okay.
intense stretch, but good.
Yep. Go ahead and resist again. 3, 2, 1, relax. And then again, afterward, those arms just drop down a little bit more now.
Mm-hmm.
Go ahead and do one more for good measure. 20, 25% effort for 2 more seconds. 1, relax. So again, that just gets like an active element to releasing that pec. It's just an interesting phenomenon because like when you actually elongate that muscle and then it's already under some stretch, and then you go to sort of recruit and activate that muscle, there's just something about that neurological trip that like causes the muscle to actually kind of like shut down and give itself up a little bit more from the blood flow neurological standpoint. So that way, after just 5 seconds of actively fighting it, it's then able to melt the muscle a bit more. That's about the most scientific I want to get on that and everything without getting into a bunch of like proprioceptive receptors and mechanoreceptors and stuff, which most people don't need to know about, right? How about I help you sit up here?
Thank you.
And then how does everything feel there, Rebecca?
Good.
I know it was only a couple of quick techniques, but hopefully that felt kind of nice to work on and everything, right?
Definitely. Well, you could see I needed that, so.
Yeah, especially that right shoulder. I don't know if anyone saw in video, but her right shoulder was definitely just a little bit up and forward and everything. Well, we hope that this was helpful. These are kind of a couple of the techniques that we really like to get at Rothrock Chiropractic and Rehabilitation. Thank you so much for watching the video. If you found this interesting, enlightening, exciting, leave a comment, like the video, subscribe to our channel so you can see more content like this. We do this every single month, everybody. But I want to thank Rebecca Hall again.
Absolutely.
And
my pleasure.
Everybody, take care until we talk next time.